Caribbean. And so thank you very much, SIHI LAC, for organizing this with us. Our session title today is about sustainability efforts for social innovation in health in Latin America. And we're very privileged to have with us Lisa. We're excited to hear from you, Lisa, later. I am Art Ongkeko, SIHI Secretariat's Partnerships Coordinator and co-leading the Secretariat in the Philippines Hub with Dr. Meredith Labarda. To those new to the SIHI network, we are delighted to have you on board. SIHI, which we pronounce as SIHI, stands for Social Innovation and Health Initiative, and we were launched in 2014 and dream of a better and healthier world through social innovations. We do this through research, capacity building, and advocacy. And also welcome to those who are already part of the network, our various implementing partners, the universities-based SIHI hubs, our contributing partners. Thanks for finding time to join us. SIHI Talks, as you all know, or some of you know, is a series of webinars that showcase the work of the SIHI hubs, our existing partners, as well as our other potential partners. The main goal is to foster collaboration and intersectoral partnerships to leverage each other's strengths and resources to hopefully build a more socially innovative and empowered citizens and communities. Before we start officially with our actual plenary sessions, I would like to call on our SIHI network lead and co-founder, Dr. Beatriz Alpa, for the opening remarks. Dr. Beatriz.
Thank you, Art, and a warm welcome to everyone. And on the behalf of TDR, the Special Program for Research and Training in Infectious Disease of Poverty, which is co-sponsored by UNDP, UNICEF, the World Bank, and WHO, we'd like to thank you, the SIHI Secretariat and the SIHI LAC Latin America and Caribbean, for organizing this specific SIHI talk today. And indeed, the network SIHI Social Innovation in Health Initiatives has now reached almost 10 years by the end of the year. And it has been expanding over these past years globally, establishing new hubs, mostly in low and the hubs are to advance social innovation in health through research, through capacity building, advocacy, so as to enhance universal health coverage and also accelerate the achievement of the Sustainable Development Goals. So in that, sustaining those efforts at this stage is a very critical element, and we need to really look at our business models and sustainability models in order to see how we can now further strengthen and sustain all SIHI impact and activities around it. So today is my pleasure to actually welcome such discussion that are aimed at sustaining efforts for social innovation in health. And we'll be having the two presentations. First, from Maria Isabel Echavarria Meria, that we know, the SIHI lead of SIHI LAC, and welcoming Lisa Bourget from the Senior Director at Duke Global Health Innovation Center and Innovations in Healthcare, who will share with us their experience at the center there, and hopefully some lessons learned that we can then discuss and see how much of this will be related to SIHI, what has worked, not worked in terms of sustainability model, and also opportunities to engage with different types of partners, including the private partners. So having said that, thank you all, and leave you the floor, Art. Thank you.
Thank you very much, Dr. Beatriz. Without further ado, I will now transfer the virtual floor to our co-host and co-organizer, the SIHI LAC, led by Maria Isabel. Maria Isabel.
Thank you, Art, and thank you, Beatriz, for that warm welcome. can you see my screen now? Yes, okay.
Yes.
So, yes, as Beatriz mentioned, most of you know me. I am the coordinator of the SIHI LAC Hub. And before opening the floor to our guest today, we want to provide a brief overview about what we do and some of the efforts that we have done on sustainability. So I'm going to introduce a couple of colleagues later on. So just to start, oh, sorry, are you seeing the big screen? No, now it's working. Okay. So the SIHI LAC Hub is one of the 13 hubs of the SIHI network. It is hosted by CDI. We are here located in Colombia, and we partner with PAHO, with the Pan American Health Organization, and also with Honduras, with different institutions in Honduras. The purpose of the hub, as the purpose of the network, is it's advanced social innovation in healthcare delivery in the LAC region through, as my colleagues mentioned, research, capacity building, and interinstitutional collaboration. How we do this? So we identify community engaged social innovation and promote them. We do efforts for visibility among different actors. We strengthen their capacities through research, training, and collaboration, and we promote the articulation of people and organizations, fostering spaces to create a community around social innovation in health in the region. And very quickly, some of our results. So between 2017 and 2023, the hub, in alliance with Honduras and the Pan American Health Organization and other organizations, has conducted 4 calls in which 21 social innovations in health have been identified in Latin America. We have carried out studies showcasing 8 innovations in different countries of the region. We have published 22 papers with the purpose to strengthen the scientific evidence around social innovation in health. And we have also organized several training opportunities, and we are conducting actually a regular webinars that we call virtual cafes to strengthen the capacity and create community around social innovation in the region. So the SIHI program for our team and for our institution has been a wonderful opportunity to learn from community engaged innovators, to understand the value of social innovation to overcome health access barriers. And it has also been a great opportunity to strengthen capacities and to conduct research on the innovations and with the innovators. But as Beatriz mentioned, for continuing doing this, the program needs to be sustainable. We have been supported by TDR since 2017. We have done great partnership with PAHO and with other colleagues. And we have also leveraged efforts from different projects and programs and other colleagues, but within our institution and outside. But we need additional efforts, and we need to explore new approaches towards sustainability. So I'm going to introduce my colleagues, Diana Quintero and Andrea Escobar. They are part of the SIHI LAC team. They both have valuable experience as innovators and as social entrepreneurs in health and food security. And they are going to share some of the efforts we have started to try to ensure the long-term success and impact of the program. So, Diana?
Yes, thanks, Maria Isabel, and hello, everyone. So please go ahead with the next slide. Perfect. So I will introduce a little bit about the process we have followed, or the path that we have followed in terms of sustainability. The process started in 2020 when, for first time, the hub developed a sustainability model seeking to gain autonomy in terms of human, technical, and financial resources, and ensure SIHI's operation in the short and long term, while we understand sustainability from a larger scope, including the environmental, economic, and social dimensions. Here we are focusing on the economic one. So the hub analyzed its existing strategies to promote social innovation in health and established 4 service lines that I will explain briefly later, and mapped the process to implement the model. This process has include first mapping potential partners and funders. It also allows us to do kind of a benchmarking exercise of our service. In parallel, also, we assessed our innovators' needs to better understand where we add value in the health innovation ecosystem. Second, structuring service and funding proposals to sell services to potential clients interested in strengthening the social innovation in health in the region. To this, we have framed the hub sustainability lines into services to identify the value proposal and cost. We have also identified funding priorities and targets in the short term based on the hub's strategical plan and operation and services costs. In this step, we have also developed communication materials such as others presentation, one-pager, and a video that we can share here in the chat. And after that, we have developed a funding strategy. In the 2023, we are focusing on developing a program to strengthen our innovators' capacity to make scalable and sustainable their initiatives. My colleague Andrea will talk about this in brief. And currently, we are in the phase of approaching potential partners and funders. This is a process of continued iteration and learning. So the last step is getting feedback and introducing to the strategy and the model. If it is the case, doing continuously as we are doing. So you can please go to the next slide. Perfect. So here, there are the 4 lines shaping our sustainability model. And as I mentioned, we are trying to package or offer the services to partners, these services to partners interested in strengthening the social innovation in health ecosystem in the LAC region. The lines are first the regional call for social innovation in health that I know that you already know deeply about this. Second, the program to strengthen capacities of innovators to scale their impact. It currently includes case studies to document their impact and workshops to build their capacity, but we are looking to have a more structured program including main needs of innovators that in this case are scalability and sustainability of their initiatives, and a more longer timeline program that includes maybe mentorship and more networking opportunities. In the future, we also would like to integrate an impact hub fund, providing innovators with seed capital to implement scalability strategies. And another important focus is promoting future leaders to have an impact on the social innovation in health ecosystem. While the fellowship program that already exists in the LAC Hub, we aim to have more funding to make it stronger and continuous, as well as offering the opportunities to fellows in addition to have an internship or research project with SIHI LAC to also develop additional capacities. Now, my colleague Andrea will share with you the details of our short-term sustainability strategy. Thank you.
Thank you. Good morning from Colombia. Yes, I am going to share with you one of the strategies that Diana just said and just mentioned. That is our innovation capacity strengthening program that we are going to open the calls this year. As SIHI LAC have been working in this program for 6 years, as Maria Isabel mentioned earlier. We are strengthening the program, and we are doing right now is improving the structure of the program and to respond to the needs that the initiatives has right now and their own sustainability that is really important for us to work on. This is our innovations capacity strengthening, and our goals here are identify communities engaged social innovation initiatives, addressing the systemic health problems and needs of individuals, communities, and societies related to health and well-being. And the other one is support and accompany the scaling up of social innovation initiatives, but listening to their needs. focus the effort of the development of capacities in the areas that they most require, and establishing a baseline for each one to measure progress. That is one of the most important things for us, to measure that progress and to be sure that they are going to move to the point A to the point B, and the point B, they are the ones that they are going to design that point. So this is a program that has 6 phases that is going to take place in 10 months. And the phases are, the first one is the regional call for social innovations in health that we are going to begin this year in the second semester. The second one is going to be the documentation of the innovations and the establishment of the baseline. That baselines are going to take to be our goals, to know how and what kind of skills they need. The third one is the face-to-face training. We are going to begin the process with a capacity building face-to-face. And then we are going to begin a one-on-one hybrid phase between face-to-face and virtual accompaniment, where we are going to set the goals and the action plans and continue the capacity building, to then going to the phase 5, that is to do the measurements of the results and the scope of the program according to the goals that they establish, and to have the metrics specific. To finally finish the program with a demo day, we want to have them the opportunity to be able to connect with organizations, institutions, people from the health ecosystem, and potential local and regional and global funders, because we want to strengthen their skills to have and to be able to fund their initiatives, to participate in this competitive system that we have today, and the funders, investors, and also improve their communications, marketing skills that most of them consider that they need. So one of the most important things for us today is we are looking for the funds to fund this program, and that is our main purpose for this year. And we also consider that our strategy as SIHI LAC is to work in alliance, to work with other organizations as social innovations, at all of the organizations that we are looking for right now. And that's why Maria Isabel is going to present you one of our invite today, and that is the important talk and conversation that we are looking for today.
Thank you, Andrea. And thank you, Diana, as well. I want to share with you that for us, from the Hub, working with Andrea and with Diana, with the experience that they have, it has been very valuable, a very valuable learning process, because in our work as nonprofit organization, as our researchers, I feel we are more experienced about creating programs and projects that we are about funding and business. So I appreciate their input. Yes, as part of the mapping efforts that we did, we identified innovations in healthcare, and we have the pleasure to have today with us Lisa Bourget. So as Beatriz mentioned, Lisa leads 2 distinct yet complementary Duke Health organizations, the Duke Global Health Innovation Center and Innovations in Healthcare, that aim to improve health and health innovation around the world. She is senior director. As senior director, she oversees the provision of business support aimed to accelerate and scale growth stage healthcare innovations in the Innovations in Healthcare network that has a portfolio of more than 100 growth stage innovators operating in more than 70 countries around the globe. And she also managed a portfolio of health and health innovations programs with various high-profile clients and funders. So she's as well a successful innovator, entrepreneur, and product manager, having identified and led several new healthcare business from seed concept. So Lisa will share their work with us today. And Lisa, we are really, really pleased to have you here to learn from your experience.
Well,
Welcome.
thank you. Yeah, thank you so much. Thank you for that very nice introduction. And yeah, good afternoon, good evening, good morning. I'm calling from the US. And what I hope to do over the next 20 minutes is give you a really quick overview of what I do at the Duke Global Health Innovation Center and Innovations in Healthcare. So I'm going to move pretty quickly through a few slides, and then we hope to tee up a really good discussion after that. So before I go into sort of all my slides, I guess I want to perhaps just say I come to this conversation with a private sector, with a private sector bent. Before I joined Duke 10 years ago, I was in industry, building partnerships, and so I have had the opportunity over the last 10 years to bring sort of a business mindset and private sector connections to the work that we do. Which hopefully I can share a little bit more about now. So we're somewhat of a unique organization in that I'm a Duke University employee, and I run two organizations that are very complementary to one another. One's a traditional academic center focused on innovation, and what I'm here to talk to you most about is this other organization called Innovations in Healthcare, which is a nonprofit that Duke co-founded with the World Economic Forum and McKinsey now 11 years ago. And as we go through this conversation, I think probably the easiest way to think about this is we're studying innovation, we're studying and collecting evidence about innovation through the academic center, and the implementing arm or the effector arm or the on the ground sort of real world experience is coming from our work with about 100 innovators through our Innovations in Healthcare network. So it's really between this very complementary, but I think top down, bottom up perspective that we've been able to I think, learn about innovation and provide funders, partners, other innovators insights into how to scale. So we have a common vision and purpose across both of these organizations, so but slightly different missions. Innovations in Healthcare is focused on increasing access to quality, affordable healthcare by scaling leading innovation. So we sort of, it's a very bottom up focus, whereas the Duke Global Health Innovation Center is supporting the scaling of healthcare delivery and policy innovations through research and education. We both organizations are unified in a vision where we want to see a world where innovation improves health for all, and really why we do this work is to make sure that really important interventions, innovations, solutions get to the people and patients that need it the most. We have one common strategic plan, and the way we implement our vision is by, number one, catalyzing the sourcing and scaling of proven health innovations around the world. So similar to what we just heard, we identify and look to build capacity in innovators, one innovator at a time. Our second strategic goal is we want to strengthen the capacity and integrate policy, payment, and delivery solutions to drive value. So again, maybe more of a top-down approach for how we strengthen the enabling infrastructure around these individual innovators to encourage and promote their scale up. And then three, share knowledge and translate insights. So of course, as an academic unit, we want to share learnings. We want to promote learnings within our innovator network, within our partner network, and across one another. And so here's a little bit more about the activities that link to those strategic objectives. And I'll talk about each of these activities over the next few slides. But in terms of sourcing and scaling proven health innovations, we are ongoing looking for growth stage innovations that we think have the evidence and are therefore at a point where they could scale to a different location or a different country, and perhaps lack the strategic connections or the funding needed to move forward. We also try and work with funders on developing a larger evidence base around the time it takes to scale up innovation, as well as sort of what some of the challenges can be around scaling up innovation. I think all of us on this call know probably at least 2 or 3 examples of a really great solution that never really scaled, not because it wasn't a good solution or it didn't have evidence, but just because it is so hard to find the right connections and to find the right funding and to be sustainable. It's a very tough journey. And then the other thing that we do is we build capacity, and we have a somewhat unique approach there. We're of course trying to build capacity in our innovators, but also trying to build capacity in some of our private sector partners, and embedding innovation, embedding a sense of how to embrace and pilot innovation in some of our leadership programs that we help design and run for hospital systems, for biopharma companies as well. So a little bit about our network. We're at 109 healthcare innovators in more than 90 countries, and our innovators have solutions that are quite diverse. We have some digital health innovations. We have bricks and mortar care delivery, microfinance, healthcare workforce training. But what is common amongst our innovators, I think, is social impact, a commitment to improving health, but also the stage of growth that they're at. So they're all fairly mature innovators who've gone way beyond a pilot and have demonstrated not only that they can deliver and implement their innovation, but that they have a business model, they have customers, they have revenue. Some examples include, again, just to give you a flavor of the breadth of the network. We have, as I mentioned, in Jacaranda Health, a community-based innovation that now augments their brick and mortar maternal and child care model with a digital component. CarePay is a microfinance innovation that we've been working with for quite some time. And then we have a few what I would call chatbot innovations in WISA and TNH, which is now Vitalk and was recently acquired, that are utilizing chatbots as an effective strategy towards improving mental health. Our second activity, again, is moving away from sort of the innovator support and scouting, developing evidence for scaling. So we have, for over 10 years, looked at the characteristics of innovative models and tried to understand sort of what, at an individual or group level, like what are characteristics that signal success, and what strategies have been successful versus have not, and really try to adapt some of these learnings and insights into supporting not just innovators, but our entire ecosystem, and as well as providing insights into policy recommendations that we think can support more innovation faster. And so to do this, we partner with both public and private sector stakeholders. And I think that is somewhat of a unique aspect of what we do. Is so it's not just that we have an innovator network and an academic institution sort of in this innovative hybrid model. I think the kinds of stakeholders that we engage, the focus on innovation is somewhat unique, and we're constantly, I think, looking for like-minded institutions who want to improve global health, particularly health equity in low and middle income countries. And whether they're in pharma or biotech or big tech, we're constantly either on a one-on-one basis or in a group setting, I think, trying to understand what their interests are so that we can add value. Some examples of programs that we run include, traditional global health funders like USAID and the Bill and Melinda Gates Foundation. We've also had a longstanding relationship with the Pfizer Foundation. They have a Global Health Innovation Grants program that provides grants and support that we provide to grantees around the world. And through many of these programs, we've either, in the case of accelerating saving lives at birth, we've sort of taken our know-how on how to support innovators and applied it to USAID's Accelerating Saving Lives at Birth Accelerator program. We've also done some work recently with Takeda on a healthcare access program, access to medicines that they have made available in certain communities in Africa. Here are, again, some other policy and infrastructure programs that we've run, as well as policy analysis and another accelerator program that we ran on behalf of USAID called the Social Entrepreneurship Accelerator at Duke. And then finally, two programs of note that we've been running recently related to COVID. So here, I think, is a great use case in some of our private sector reach. And we've been able now to work with several foundations, including Pfizer, on launching the COVID Treatment Quick Start Consortium. And through this program, we are extending access to Paxlovid in 10 low and middle income countries, as well as conducting operational research and convening a learning network around test and treat strategies, not just for COVID, but for other conditions in which rapid test and treatment is needed. So, all right, I want to pause and maybe take a little bit of a pivot. So much of what I've shared with you is sort of our programmatic focus, our strategic focus, how we convey value to the outside world. But I think it's important, if we're going to have a discussion about sustainability, to look inside. And I thought I would share a bit about sort of our governance and business model. So as I mentioned, we're two organizations that are co-led by me and an executive team. We report into the Duke Global Health Institute, which is a part of the Duke School of Medicine at Duke University. And we also, through innovations in healthcare, report into a board of directors. But I think what I wanted to focus on here for just a minute or two is, so how do we sustain ourselves? So much of this conversation has been about capacity building in innovators, capacity building in stakeholders, and helping those different stakeholders have sustainability strategies. But of course, we can't do that work if we're not sustainable. And the way our business model is supported primarily through grant program funding, capacity building and training revenue, and some memberships and sponsorships that we generate as a result of running different convenings, and either in person or virtual. And so again, what this slide is really just showing is much of our business model is like a traditional academic center in that we are responding to and co-creating grant proposals, and I think running those grants and finding core faculty and staff to help support those grants. We also, through our capacity building and training, I would say is more like advisory services, where we work with different, primarily private sector clients on specific capacity building and advisory for them in a wide range of support services. It could include health leadership. It could include helping to support an innovation agenda for a health system. So again, those are really the two key components of how our business model, what it looks like and how we sustain ourselves. So I guess I want to, end sort of the discussion or the presentation, but maybe start a dialogue and tee up two discussion questions. And the first is, in thinking about your organization's business model and sustainability, what's worked and what hasn't worked. So, I would love to hear from each of you, what have you learned that could really help someone else on this call or give them a head start in this process of sustainability, and what opportunities exist to engage the private sector to support innovation. So with that, I will pause and ask, I guess, my colleagues to add any of their discussion questions before we open it up to the floor.
Thank you very much, Lisa, for that really nice presentation. And I feel very lucky to be connected with you and have the opportunity to learn from this presentation and of course, more later to continue discussing with you. So I want to invite my colleagues at Philippines and Beatriz, and of course, us from LAC and the audience to open a nice discussion. And maybe we can start by sharing with Lisa some insights related to the question that she is asking. And of course, we will also want to learn from you, because I see that you are very successful at reaching private sector. So it would be nice also to learn from you and to know your answers also to this nice question. So can we put everyone in the panel maybe? And I will invite Beatriz as well, Diana and Andrea. Great. Thank you. So any of us, well, let's start for the panel. Any of us in the panel want to share with Lisa about our experience on the model that we have used so far, and also our let's say our way to approach private sector, what has worked and what maybe need to be done in another way?
Maybe I can share that one of the things that we are working on in the sustainability experience and strategic is to focus in the skills of the initiatives. That I think that one of the things that SIHI LAC are working on right now is to focus in this program that we just present you, because we consider that the private sector, that first the initiatives need, and they feel that they want to change and to strengthen specific things from them. And most of those things are related to skills that they don't have, like communications, like marketing, like looking for funds, like sustainability. And that's why we are looking for having this program. And I guess to answer that question is that's why we are building this program. We think that through this program, we want to share with them, and we want to strengthen their skills, to have the opportunity for the private sector to see that these initiatives begin in this point, with these skills and with the kind of needs, and they just have the opportunity to train them and to improve them and to have more skills and have the other point. So we are changing that point and that kind of mindset, just to have this information really organized and to focus in the initiatives.
Thank you, Andrea. Beatriz?
Maybe Beatriz first, and then I'll go next. Thank you.
Sorry, so maybe what I'd like to share is actually our last partner meeting in 2020, where we engaged with the private sector and trying to see how they could support the SIHI hubs. And what came out of this clearly was that we need to be more able to show how the value added of the hubs in terms of making an impact on healthcare. So what's the value added? And maybe this is also a question for Lisa, who kindly, thank you, Lisa. That was a really, really inspiring presentation, because we could have a lot of insight. So thank you for sharing. And see, like you mentioned grants, you mentioned so the regular training activities, and you mentioned you had to set up, I don't know if it's at the same time or not, you set up the global, the Duke Global Health Innovation Center, and then the Innovation in Healthcare NGO in a way. And there might have been reasons for that. Would be really interesting to understand in terms of how you sustain and how you could show through the grants or through whatever your added value. I think this is what we would be very much learning from. How can we show, because we all know and think that adding research to social innovation will make it more sustainable. You know, the theory of change is kind of clear, but how do we illustrate that really? And maybe adjust the model. So that would be my question and comments at the same time. Over.
Happy. So I guess our theory of change, so the reason why we have two organizations is because we supporting innovators isn't necessarily the mission of Duke University. So Duke University, Duke University Health System is a traditional academic health sciences system, research, education, care delivery. And so this idea that if we wanted to be credible and provide insights on health innovation in low and middle income countries, we really needed to have an effector arm to do that. So that's I guess the reason why we created, or we have two separate organizations. I think we would not have the success and credibility as an academic center that we do without the access and talking to innovators and helping to support them in real time, and vice versa. Because of the research work that we do and the capacity building, we also that provides us access to foundations, bilaterals, multilaterals, private sector that then our innovators need. So it's a very symbiotic situation in that we are often trying to be an intermediary between the two. I think the second question is, how do we sort of this, I think, idea of theory of change, conveying a theory of change and converting it into perhaps a value proposition to private sector. So when I first came to Duke and to global health, I'd never heard of, like, the concept of a theory of change was new to me. I mean, in the private sector or in venture capital or startups, right, your theory of change is your investment thesis. It's very similar. So I would say, I think knowing the language of who you're talking to, so private sector, well, first of all, private sector isn't a monolith, so I don't want to make it sound like, company A thinks like company B, but I think we spend quite a bit of time building and maintaining relationships that may never lead to any sort of transaction or funding, but there at any given time are, probably hundreds of relationships that I invest in, my team invests in, and as we're setting up different convenings or releasing reports, I might send a note to somebody in a company or in private sector saying, hey, I think you might be interested in these insights, and that may lead to some sort of conversation about how we might work together. Or I may be talking to an innovator tomorrow morning who needs some sort of connection from private sector. Then I would send a note, sort of saying, this is what we'd like to do. And that may sort of open up something. But I think where I'm trying to go with, I think there's two key takeaways that I guess I would like people to think about is, I think relationship management and making a commitment to maintaining relationships, not just for a transaction or funding, but constantly meeting new people in private sector and understanding what their interests are in global health, because surprisingly, many private sector organizations are doing really great work that you'd probably be surprised at, and do need some help and do need some support and insights. So I think it's relationship management, and it's also converting sort of your theory of change into sort of an investment thesis, or a why is what you do important to them? How is it going to give them a head start? How is it going to reduce friction for them? And even though what you're doing may not have a financial ROI, they are they want to know what your social ROI is.
Art, you wanted to say something?
Wow, I'm just really inspired by those responses. Those are like really amazing, especially at SIHI. It's really challenging to wrap ourselves around what's the financial ROI of it. So I'm really glad to hear that there's such a thing as social ROI. So it's really exciting, something to think about for the network. But just to answer some of your discussion questions earlier on, I think I can speak as a member of the University of the Philippines, SIHI Philippines Hub. I think as university researchers, there's always a tendency to go on a traditional route, like just go and engage with government sector, providing funding through grants, etc. But we haven't really tapped into the private sector or the NGO groups that are actually willing to provide you opportunities to co-develop events or co-organize events, and then provide you actually funding. And actually, the last few months for the SIHI Philippines Hub, there's local government units and private NGOs coming to us to run design thinking workshop, for example, amongst innovators and local government units. And we're asking ourselves, how much do we charge them? Because we don't have an idea. So I mean, those are actually good business models already. So when you showed the revenue streams that you have, your business models, right now, what we have is just the grant stream. We haven't really tapped into what I think right now. What we're doing is to really taking stock of what we have, packaging them as products or services, and really provide, then probably market it. And for someone who's going to be probably interested to adopt it or to ask for our services, to probably how to implement those. But I suppose my question therefore in relation to that, okay, go ahead, Lisa.
Well, no, I wanted to just, sorry to interrupt, but I just wanted to mention, I think, the how you cost and price a grant is quite different than how you cost and price what you're just talking about, whether you want to call it executive education or a convening or advisory services. And so, one is, at cost, and one is cost plus some sort of margin, or, and so that margin, I think, if I guess I want to empower everyone on this call. What you're doing, if private sector is coming to you saying, we want your help with something, then they see value in what you're doing, which is great. Maybe that's a clue for how you could, what a future business model might look like. But it's also, an indication they're willing to pay more than cost for that. So I think you should feel empowered and encouraged to charge a premium for that, because again, that's what they do. I mean, they in the private sector is very good at, they have products and services that they market, and it hopefully has a value proposition that gives someone else a head start, and people will pay a premium for that. And that's, I guess, the message is just make sure that you're really thinking that through.
Thank you, Lisa. But I actually just have two questions that I would like to your inputs on. So first is, you said earlier that part of your work is really building evidence on innovations, researching on them. But what's the pivotal point where you get enough evidence and then you're starting to get or to receive traction from other grant giving bodies, private sector groups providing you or coming to you to give you support or partnering with you for convening? And the second one is, what sort of support structures do you have when you're still starting for the innovators, and what are those key elements therefore that now you have that big 100 plus innovators community of innovators that you're working with? So those are like my two questions.
So we have an engagement team. It's a fairly small team that regularly meets with innovators that are interested. And I would say we're unlike an incubator and accelerator program. Once you're in our network, you're in our network. And for the first year that you're in the network, we engage and do more with you than maybe subsequent years. But I would say, I just actually had an innovator who I used to work with quite a bit from 6-7 years ago reach out to me. They want help with something in particular. So the answer to your question, Ars, we've got a couple of people whose job it is to sort of be that support person for each of our innovators. Again, some of our innovators utilize that, some of them don't. So that's one. And then, in order to scout, we do a fair amount of desk research. And I would just say in all the conversations that we're having, we're kind of always, like I'll give you an example. I was in the Philippines 3 or 4 years ago on something completely else, met a couple of innovators, one of whom is now a part of our network. So I think in some ways we kind of always have this, we're always scouting, we're always looking for innovators that have something really worthwhile that needs to be shared with the rest of the world. And we're always looking for partners who are supportive and want to be involved in the work that we do.
Thank you, Lisa. I don't want to consume much of the time because we only have 2 minutes. Go ahead, Maria Isabel. Maybe Diana will have some feedback as well.
Yeah,
Diana.
basically, I think one of the aspects that we are working on, it's, specifically with the strengthening program that we are proposing for basically supporting our innovators to scale and being sustainable. It's also learning how this value proposition, it's something that is connected with the core business of the private sector, because basically I think this model that the private sector is providing funding from corporate social responsibility, it's something that we are moving out, and it's more understanding how our value proposition really links with their business strategy, and also thinking, why they are really interested in supporting our innovators. Because if we connect these two pieces, it makes sustainable the partnership. And and when they are running out of budget, they will not cut this because it's something additional, but it's because it's something that really supports their business strategy. So this is something that we are trying to understand and kind of incorporate, because also our innovators, they are our users, but also we need to think also in these partners that we are also providing a service to them, and also what kind of service and why it is important. So I think it is just something that I wanted to highlight of basically the experience or some of the conclusions that we are early gaining as part of this process to engage also with potential partners and funders.
Thank you, Diana. I know you need to run away and we are out of time, but do you have time, Lisa, for maybe a final question?
Sure.
Yep. So I just wanted to, I mean, this has been very grateful, and we need this to continue this conversation, but I wanted to ask you, what is your experience on supporting innovation, specifically in Latin America? Because since we are working into strategies, we are working as a network, trying to be sustainable and to find partnerships and funds and donors globally, but we are also doing some efforts locally and regionally, trying to support our hub. So I want to ask you if you have any experience, input, suggestions about looking for funds for innovations in Latin America specifically.
Yes, so we have several innovators in Latin America. Actually, that's how we know Diana. I would say it really depends on the kind of innovation and the business model of the innovator in terms of what works for them. So I think we have an innovator in Mexico that's really revolutionized and innovated diabetes care. They require a different set of partners and a different set of funders. Obviously, there's a lot of private sector opportunities because of the type of innovation that they have. And then we also have a few digital innovators. And so I would say, it really depends on what is their value proposition, and what private sector entities, including mobile phone companies, private foundations, either in Latin America or outside of Latin America. I think, more traditional sources of global health funding from Gates and from USAID may not be as readily available in Latin America as it is in other parts of the world, like Africa. But they're certainly, again, I guess I would just really say it really depends on what the value proposition is of the innovator.
Okay.
Maria Isabel, maybe we could just ask two more questions. Is that okay, Lisa? So one from Jacqueline on the chat box. Could you comment more how research informs the sustainability path? And then after answering that question, maybe we can take one more from Uche Amazigo.
So we haven't done any research per se on the chatbot. I don't know if that's what the question is.
No, sorry. There's a question in the chat box from Jacqueline Alger.
Chat box. Okay.
And she's asking about your comment on how research informs the sustainability path.
Well, it informs our sustainability path in that it supports assuming that a research interest of a funder intersects with our research agenda, right? It helps us gather important data and insights that, right, we can, it helps improve our gravitas, our reputation, our ability to provide insights to funders. And I think it also just, again, it's like another way that we get closer to a funder. And also, right, not the least of which is, as you're doing research, you're conducting interviews with lots of people in the ecosystem that then know who you are. And so I think it helps our sustainability tremendously and is very much core to our mission. And I think the research that we generate and the insights that we produce helps our innovators' sustainability, because hopefully it gives them some indications on scale-up challenges and opportunities.
Thank you, Lisa.
Thank you.
And one more question from Uche. Uche.
Yeah, thank you very much, and greetings to everyone. Lisa, I'm very sorry I missed part of your presentation, but I was able to also join you before you ended, and it's very inspiring. I have just one or two questions. It seems from what you said just now that you're supporting innovations in Africa, and I'm wondering, which countries are you supporting? Is any of the countries in West Africa? Is Nigeria one of them? And can your team adopt a hub, a SIHI hub, and help that hub to develop into the type of great team that you have at the moment, at least to start something? Is that feasible? Thank you, Lisa, and thank you very much for a very excellent presentation. I do hope, Art, that you put it on for us to look at, because I missed the beginning of her presentation. Thank you, Lisa. Thank you.
So we do have some innovators in West Africa. Actually, I just talked to a new innovator that we're working with in Nigeria yesterday. But it is a place where I would say I would like to, I need help. And so I think we need help in through partners. And so I think that separate to this, I guess, discussion or convening, I think I'm certainly interested in exploring partnership opportunities with SIHI and some of the partner hubs, because yeah, I mean, I think we want to extend some of our approach, but I would say, the world's a very big place, and we have, kind of a limited team, and I think are very keen. And I would also say a lot of our funders who are interested in the research work that we do, we're realizing we need in-country partners to help us identify innovators and do the research that people really want us to be doing. So yes, we're I think hopefully gonna, in maybe a week or two, start some conversations around maybe how this conversation leads to some more formal collaboration.
Thank you very much, Lisa. Thank you. Noted. Thank you.
That's wonderful, Lisa. Thank you. I think that was the purpose of this, reaching you and discussing a couple of times with you, and now bringing to the network your work. The idea is just to understand and learn from your experience, and also to see opportunities for collaboration. So we are grateful, yeah, that we have this space. I don't know, Beatriz, if you want to say something before leaving.
Yeah, thank you so much indeed to all of you. And thank you, Lisa. That was very interesting. I also noticed that some of the innovation that you have been supporting are also some innovation that SIHI had supported. So there are also some overlapping parts which are interesting. And I think it'll be great to identify potential collaboration and how complementary. So definitely we'll be happy to learn even more from you, but we'll also be happy to develop opportunities and co-create opportunities, or even jump in something that you need and that the hub is able to provide. But definitely, as you just say about the Duke program, really open to new collaborations. So is SIHI, and we'll be very pleased if we can count you and your team and program as partners, and look for great collaboration. So thank you so much. And it's just like about what will be next steps.
Yeah, I think there are many, and there is a lot of overlap, and I think alignment in how we think about the world, and so yeah, I think it's a good opening and foundation to have a partnership conversation.
Great.
Great. Great. We will be contacting you after you come back from vacations, and we will continue this conversation. So thank you very much, Lisa, again. Ernesto, I know that you were also over there. Ernesto is a colleague of Lisa. And also thank you to everyone for being here. Beatriz, Philippines, Art, thank you so much. Andrea as well, and Michael. Very nice to see you.
Thank you, everyone.
Thank you.
Thank you.
Thank you for
Thank you
so much.
Bye. Have a wonderful day.
Bye.
Bye.
You too. Bye-bye.
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 Congrats, Mary Isabel. That's great.